All right, good afternoon again, everyone. My name is Stephen Davidson. I'm the Director of Public Relations and Communications at the Ministry of Health and Wellness. We want to thank you for joining us for this press briefing. And we want to acknowledge our Minister of Health and Wellness, Dr. the Honorable Christopher Tofton. We have with us as well the Permanent Secretary, Mr. Dunstan Bryan, the Chief, we have, like in the church, we let them know who you are, the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. CMO acknowledge. And our Director of Health Promotions and Protection, Dr. Simone Spence. And we want to thank you again for joining us. We'll begin with our statement from the Minister, and then any support statements from our PS or CMO, and then we'll take your questions. Please welcome the Honorable Minister.
All right, thank you very much. I'm going to ask the Chief Medical Officer and the Permanent Secretary to join me, and that they observe social distancing. I know they know very well. I'm just being facetious. All right, so thank you very much for joining us. And let me just begin by saying that this will represent, at least for the time being, our daily press brief. We think that it's important, and the Cabinet, the Honorable Prime Minister, thinks it's important for us to maintain constant conversation with the media and by extension with the country. We appreciate the efforts that you put out to transmit this information across the country, and we do need citizens of Jamaica to appreciate what is happening, and by extension to generate a response that is in keeping with the approach to get rid or to control this public health threat. So we will always make ourselves available and provide the information as it is available. So let me just begin by saying that today we received 5 test results, and of the 5, 1 is confirmed to be COVID-19, 4 are negative. So 1 confirmed, 4 negative, which brings the numbers now to 13 of positives. This particular one is linked again to patient 1. Remember, I replaced 0 with 1 last evening. So this is the first patient from the Bull Bay area. Another positive test linked to patient 1. It also justifies for us why we took the decision to quarantine that Bull Bay 7-8 mile area, because so far the numbers that are linked, if they were moving about, it would certainly create greater spread depending on where they would have gone and who they came in contact with. Tomorrow we are going to be doing an additional 11. Well, we have slated 11 tests to be done, I hope between today into tomorrow, and we will give you information on that as it unfolds. In terms of the overall statistics, or status, 413 persons have come into the island from a country of interest since January 31st. There are now 12 confirmed cases of COVID-19, 13 confirmed cases, of COVID-19, given that we have just added 1. 27 persons are in quarantine in a government facility. 52 are in home quarantine. And note that these home quarantine numbers do not include the residents of 7 and 8 Mile Bull Bay. 26 persons are in isolation in government facilities. Effective of today, the Prime Minister read the gazetted state procedures related to the restrictions over the next 7 days, starting Wednesday, March 18th. All operations will be scaled down for 7 days. All public gatherings are limited to no more than 20 persons. The Prime Minister read the Disaster Risk Management Enforcement Measures Order 2020, and I'm just breaking it down to give you some of the specifics of the measures read, again, in an attempt to get the public to appreciate what is contained within this new enforcement order. So all public gatherings limited to no more than 20 persons. In terms of the public sector, government workers will continue to have their duties assigned, but we are restricting or limiting workplace work and encouraging work from home. And the permanent secretaries or head of agencies have been mandated to push for that and to organize that. The intention, of course, is to limit person-to-person contact as part of the overall strategy. In terms of the private sector, private businesses are encouraged to minimize public engagement. Similarly so, where possible, employers should have staff work from home. In terms of those entities that we appreciate the value to remain open, retail services for the provision of food, medicine, and other necessities, supermarkets, pharmacies being key. Restaurants would remain open or be allowed to remain open, but limited dining in. In other words, we're encouraging takeout as opposed to in-restaurant dining. Markets, as was announced, open from 6 a.m. to 2 p.m. Hospital, infirmaries, and nursing homes would remain open, of course. Ministries, agencies, and departments of government with limited at-work operation. Tax Administration, Jamaica, Bank of Jamaica, Jamaica Customs Agency. For banking businesses, as defined by the Banking Services Act. And I want to just indicate that I know of some banks, at least one today, and places of amusement. The metro are limited to seated passengers only. So seated passengers only. Taxis are required to transport one passenger less than they are licensed to transport. So in one case, I think it's 5, so they'll be allowed 4. In another case, I think it's 7, so they'll be allowed 6, so 1 passenger less. In terms of hospital, nursing home, infirmary, and infirmary visits, hospital, nursing home, and infirmary visits are now reduced to once per day and 1 visitor per patient. Again, as I said yesterday, persons tend to take more of family members and friends to visit. We're restricting that to 1 person per day, 1 person per patient. Clinic and hospital operations, outpatient clinics in hospitals are to be scaled down. Main services offered at Type 1 and Type 2 facilities are going to be suspended, and we're going to be giving notification via those entities and to those patients that we have on record as it relates to the scaled down operations. But again, it's an attempt at reducing the crowding effect while still preserving the services that are important, and also, to some extent, freeing up some resources to deal with the possibility of persons with COVID-19. In terms of the Bull Bay 7-8 mile community surveillance procedure in KSA is overseen by the Ministry of Health, coordinated by a number of critical health stakeholders. Surveillance activities involve mapping done by the senior public health inspector. There's a team of 3 persons, usually with a technical officer and 2 support staff. Each head of household answers screening questions, and the temperature of persons are routinely taken. That's how we decide who to extract from the community and place in quarantine or to do further examination in isolation. If there's a positive sign or a temperature or symptom, the person is of course informed and the follow-up action is made. Arrangements have been put in place for medical officers to be on call for medical direction in the community and support to social services under the leadership of the Ministry of Labor and Social Security, who are distributing care packages for families in the zone. Now, I want to just pause here to say that we have heard yesterday that some persons were suggesting that they were not getting these packages. We have indicated that to the team on the ground. We reiterate again that for persons who feel deprived as it relates to food items or basic essential items, that they report that to the personnel who are placed or based at the locations. and we will do the necessary follow-up. We've also engaged in conversation the NGOs, the typical NGOs that have been accustomed to providing support in circumstances of this kind, the Salvation Army, Food for the Poor, and there's one other, I think. But we are also the Red Cross, so we're mobilizing them to be a part of any support services to those persons in the area. The National Health Fund Drug Serve Mobile Unit has been assigned to provide pharmacy services, and I believe they should have been there today. If not, they certainly will be there tomorrow. And that would address persons who need medical support. And Fridays on persons coming into the island who are coming from a country where the virus is spreading internally. That was part of the announcement yesterday. We will place on our website those countries that are affected. I believe it's somewhere over 80 countries currently. It changes fairly frequently, but we will place those on our website, and so persons can be informed as to which countries these are. The quarantine arrangements applies to both locals, but also persons coming, anyone coming from those countries. And the requirement would be for home quarantine for those who are coming back into the island. And in the case of hotels, we want to just emphasize that there is a restriction around quarantining, but the guidelines for hotel quarantining are as follows. And I'm going to just cite the sort of significant features, just to be clear. So guests are allowed to move in and around the hotel. So it is not, and let me repeat, it is not a restriction to the hotel room. It's more a restriction to the hotel property. Persons can go to the pool, they can go to the beach. What we are emphasizing, however, is that we, as best as possible, and the hotels have to do this, maintain the social distancing that we have been promoting because of to minimize the risks of spread. To the extent that guests do not have symptoms, if they have symptoms, they have to be confined to the room, and there's a protocol in relation to notifying the health authorities. To the extent that they don't, then they can move around. And they can, and just to be very clear, they can return to their country of origin anytime within that 14 days. So we're not suggesting at all that persons who come in and under these new guidelines are going to have to spend 14 days in the hotel. If you book your vacation for 7 days, then you certainly can come, stick by those rules, and return within the 14, unless you have symptoms. If you have symptoms, then clearly you really need to be in a hospital and need to be treated, and we would have to reserve the right to support that in order to reduce or minimize the possibility of the virus being spread internally. So that's very important for the hotels. And like I said earlier, the list will go up on the website in short order. I want to just comment briefly again on a few other things. Firstly, we will establish a standard format, a template, if you will, to release each day on some of this basic data that I've outlined. So number of cases globally, number of cases locally, number of tests done, negative, positive, that sort of thing, so that the public can keep informed as to what is happening, in addition to what we will do at these discussions or these briefings. Secondly, there has been some discussions around a particular drug out of Cuba and the efficacy of the drug or the effectiveness. As you all know, Cuba and Jamaica enjoy very positive relations. We are expecting a number of nurses to bolster our public health response towards this threat, and that is based on the long tradition of working together that we have. To the extent that there is an a new response, a medical response, a pharmaceutical response to COVID-19, we would be very interested to learn more about that. And so the conversation will continue in that regard. Our medical team here, clearly we operate with a standards agency that has to vet medications and so on, and then register to make available to the public in the public's health interests. And I have had discussions with the Ministry of Foreign Affairs and Foreign Trade to inquire, and to the extent that that drug represents the promise that has been placed in the public domain, we would certainly investigate and determine how best to use. Beyond that, I want to say that we have sufficient reagents to test. We have enough to test, is it 2,500? Approximately 2,500 tests. We just got new stocks, is it yesterday or today? Yesterday. And we are ordering additional in anticipation that this will last for a particular period of time. So there is no issue right now as it relates to our capacity to test. A number of persons have been saying, why not try to expand testing, and to get rapid tests so persons can go to several locations to get the test done. Just to say that this is not possible at this time. For one, the reagents or materials are not readily available. This is a developing situation. Secondly, persons have to be trained, and the persons who do the testing now at the National Influenza Center at the university were trained by the Pan American Health Organization, so it's not something you can just distribute. It has to be done under controlled settings. And the fact that this is a new virus is something that we have to also respect in terms of the protocols, because you're also gathering data or information which ultimately will lead to a standard procedure. So at this point in time, it's not practical to do that. Finally, the nurses and the challenges that they face, the frontline workers. Tomorrow, this is in regards to transportation to and from work, and the discriminatory practices that some taxi operators have been engaged in refusing to take them back or forth. We have condemned that action, and I've had discussions with the Minister of Transport, and I know he has taken up some of the concerns with the different associations. I've had dialogue with the nurses and the president in particular, and we're going to be looking to see what arrangements can be made to give some critical support to our frontline staff. It may not be taking you from work to home, but certainly taking you to a central point. A number of hospitals currently do that. We're going to be reviewing it to see what else can be done. In addition to that, tomorrow, I am going to hand over, assuming we can get the logistics right, if not tomorrow, the next day, 5 new buses that have been purchased for the nurses to provide critical transportation to those central points. And I know 5 is not enough for the entire country, but it's certainly a good start. We will also be talking to the management of the hospitals to see what other arrangements can be made. So thank you very much. I will close here, and CMO, you want to add anything that you think is worth adding, or questions? Just the questions, you sure? Okay. What about you? Yes?
Just one.
Okay.
So good afternoon, everyone. Just one bit of information that I want to add to the conversation. Today, the Planning Institute of Jamaica hosted a donors conference with the donor partners here in Jamaica to see what level of coordination and support that can be provided during this period. The donor partners committed their support, and we will be putting together our needs list, and that will be sent to the donor partners so that they will be able to give us the necessary support to undertake the activities in terms of the COVID plan that was designed and developed in partnership with the other ministries, departments, and agencies, but led by the Ministry of Health and Wellness. I just wanted to give that bit of information.
Okay, thank you very much. Questions? Okay, I see the Gleaner, yeah, okay.
Nick Hoybers from the Gleaner. I know you just mentioned that you can't necessarily test in all areas, but I know in relation to patient one, you said that there were about at least 200 persons who were being looked into. Why haven't we tested those individuals? And also, why are we only testing people who are
Symptomatic. All right, I'm going to ask the Chief Medical Officer to address that.
Right. As it is now, our protocol is that when the person meets the case definition of a suspected case, that is when we test, and that involves the presence of symptoms. We have to be very careful in terms of the timing of the testing. If we test too early and the test is negative, for example, if we test all the contacts and the test results are negative, it gives a false sense of security because there is an incubation period that can last up to 14 days. And so many of these persons, we have taken them like at day 3 about of their exposure. So we really have to wait until they develop symptoms and then we would test. And because these persons are being monitored in facilities, we're picking them up early. So a lot of recent case studies have been out to say that persons can transmit when they're very, very early, just starting to develop symptoms. That's the benefit of quarantining the household contacts and the very close contacts, because we pick them up from the temperature starts going up. We're not picking them up and transferring them to isolation when they're coughing and sneezing and infecting a lot of persons. We're picking them up, we're monitoring them closely, so we get the very early symptoms, and then we can do our test. We will get a better chance of knowing exactly what is happening at that time. Mm-hmm.
Thank you very much. Nationwide?
Yes.
Go ahead.
All right, thank you. Brittany Clark, Nationwide News. Just asking for an update. I remember I asked yesterday on the numbers of persons at each of the facilities, if we could have an update on that, as well as whether or not we can have an update on whether or not there's any contact tracing being done for the patients at St. Anne's Bay Hospital, and if there's any mention of any community that they were a part of or anything like that, as well as an update on the conditions of the earlier confirmed patients with COVID-19.
Let me ask the CMO to address that also.
There are so many parts to that question. I can't remember.
Number of contact tracing at the same time.
Oh, okay. Right. So while it is that we have said a lot more about the index case, because as you realize, based on her itinerary, she did a bit of movement, especially around her community, and so there were a lot of contacts. But our public health teams have been on the ground in all the parishes where we have persons, and we have been finding the contacts. We have been putting them in self-quarantine. For those persons who have developed symptoms, we have been isolating them. So far, we have tested contacts for the other cases because there were a few of them that have been symptomatic, and those were included in our negative results. So right now, we have two imported cases that have contacts here that would have become symptomatic and would have tested positive. And those are all isolated and in isolation facilities. But a lot of work has been going on in all the parishes to find these persons and to bring them in. And as we're here, I just want to make an appeal to the public, because some of these persons have been resistant in coming into facility. And so we just want to encourage persons that it is in their interest and in the interest of their own families that we bring them in to be isolated so that they can be tested and treated until they get better. Right. So all the persons that we have that are contacts or confirmed cases remain stable. We yes. I just want to say that we have been picking up a lot of influenza, and many of the contacts who have been symptomatic and many of the cases that have come in have tested positive for influenza. So we are getting alternative diagnosis as well to explain many of the symptoms that we are seeing.
All right, thank you. Anthony Locke, TVJ. Minister, why is there seeming hesitation to close our borders?
It's not hesitation as it is attempting to mitigate the public health risks while balancing the need for business to go on in the economy. There's life after COVID-19. There is a need to survive during COVID-19, and our economy is structured a particular way, which depends on a series of activities that allows us to be classified very clearly as codependent. And by the way, it works both ways. So it's a function of our visitors coming here, for example, tourism being our main industry. Our nationals coming back home, we have a very large diaspora. But very importantly, we are food dependent. We have an import bill of over nearly $1 billion a year. The last time I looked, it was 800, almost $1 billion. And so when we spoke to the restrictions, but had exemptions for like customs and so on, clearing ships, loading ships, it really is an attempt to ensure that we, as a country, we can maintain some of the basic needs that we have, that some industries can continue to function because we need our workers to the extent that we can preserve their work to continue to work, to support their families. But we're doing so in a manner that recognizes the extent of the risk and where we have to take action to restrict, we're restricting. Now, other jurisdictions may have been less rigid and others have been a lot more rigid. What that suggests or should suggest is that countries adjust to the context that they're in and the burdens that they have to bear and overcome. So a wealthy country may decide, because it has significant reserves, to totally shut down its border. And then, of course, go to Parliament and approve significant sums to provide significant support to their economy. We are not that wealthy, even though we're getting there. And therefore, we have to recognize and consider all of those conditions. So that's kind of a long-winded way to explain it. The bottom line is we have to balance between the public health interests and the need to protect our society and the need for certain things to continue.
With that being said, is that something you would be for or against should the need arise?
I didn't get that. If what?
Is it something you would be for or against should the need arise?
For or against what? The restriction?
Closing the borders.
No. To my mind, I take advice from the clinicians. I'm not the kind of doctor that has clinical knowledge. The chief medical officer is right here, the permanent secretary, as the CEO of the ministry, and we come together and we take advice. But the general principle for me is that the extent of the risk determines the extent of the response. So we have 13 cases. We have 1 community quarantined. We have 3 or 4 other communities where contact tracing is taking place. We have announced a series of measures for self-quarantining, for closing of businesses or restrictions. To us, that is a measured response to an assessment of the risk currently. But that could change tomorrow or next week. And that's the principle on which we are operating. Any other?
Yes.
Yes, okay, you have the mic.
All right. So as it relates to the gathering restriction, as it relates to the supermarkets, is it that when I go to the supermarket tomorrow, I'll be one of 20 in the supermarket? Is it that you'll have a lot of people in the supermarket, but while there, you're observing the gathering restriction in terms of
Right.
so the social spacing? How are we supposed to operate?
So let me say that the measures as have been announced requires the citizenry of the country to understand what we're doing, why we're doing, and assume some responsibility in terms of its own conduct and operation, because we're all at risk. So the idea of social distancing is something that we certainly ask you to help us to explain as we try to explain it ourselves. And we hope that the average citizen would recognize that they need to avoid gatherings. And that's why we put that 20 or less, even though we hope you avoid it altogether, will cause you not to congregate, whether in a supermarket or in a market or a church, beyond those guidelines, because those guidelines are established based on an understanding that there's risk involved in abusing those guidelines. So to your question as to the supermarket, we appreciate the need for you to buy your food. And let's be clear, some Jamaicans only have enough disposable income to buy their food every day because they work and live, as we call it, from hand to mouth. And to shut down food establishments, whether it's a corner shop or the supermarket, would be tantamount to saying to Jamaicans, you may not have much to eat for the next 7 days. That's impractical. And that will raise several other challenges which we can't solve. So the allowance of opening while guiding the population and the gathering is the best option given the context that we have. And so it means then that if you're going to the supermarket, try not to congregate. Go buy your stuff, take it home, and ensure that your family is appropriately fed.
I have another question. Just
Okay.
last question. So I know that the ministry is working with several models. Are we on par with any of those models, and how?
Models as it
In terms of
relates to?
epidemiological models.
Right, so I'll ask the Chief Medical Officer to answer that, but we do have, you mean the modeling as to where we think we will end up? We did make that public. I have our epidemiologist here, Dr. Webster Carr. You want to give us a 1-minute explanation of the modeling without going into too many details. But the answer to your question is yes, we do have a model. Dr. Webster Carr, you want to come? I don't think you can make too many assumptions now, but let me ask the Chief Medical Officer to respond.
I think that we're right at the beginning of this outbreak. We have to understand that things will evolve, and we can't make any calls right now. It's not only that it's a new outbreak here, but it's also that it's a new outbreak on this side of the world. And so, our expectations are going to be tempered by what we see happening every day. So it's a little bit too early to make any kind of call as to what is going to happen. But our planning and our preparations continue.
That's your third question.
It's a follow. I recall that the Minister article saying that our peak will be 8 weeks. That's why I asked the question. I want to want to clarify on that. How can we then say that 8 weeks from now is peak when? You're saying we can't tell where we're going.
Okay, I'll ask Dr. Webster Carr to give you an idea on how that modeling is done.
So when we spoke about the peak week and 8 weeks, it's from where we start seeing an increase in cases. Right now, we are before that sort of increase. So it would have to have some amount of community spread, and then we start seeing an increase. When we have that, what we call the inflection point, then we count 8 weeks from that. It's based on an influenza model, so we're not quite sure it will work the same way for a coronavirus. So it is helpful for planning and for preparing, but it has its limitations.
Yes.
Okay.
Sir.
Yes, Balfour.
Yes. I just wonder if you can clarify something for me, sir. I saw in the news earlier this week that there was some quarrel between the funeral parlors and the people who are supposed to pass these bodies for treatment. I wondered if you could clarify that for me.
All right, let me ask the PS to deal with that.
So what the issue was with the funeral parlors, and then I'll ask the CMO to clarify more specifically, is that they wanted to know how to treat bodies if someone would have passed from a COVID infection. And they wanted to know if there were any additional procedures that should be taken because it's an infectious disease. And they wanted to be sure that the protocols around how to treat that type of infectious disease would a body that has been impacted by this infectious disease was clear to them, because they had not seen any additional protocols. But then I'll ask the CMO to speak to the protocols around how the treatment of bodies would apply.
Okay, I just want to say that we are meeting with the funeral homes representatives tomorrow to clarify any issues that they have. We know that during the time of Ebola, we had sensitization with them, and there was a difference in the treatment of the bodies at that time. And so I'm sure they want to be clear if there is any difference now. But with this particular disease, there is no difference in terms of how we treat cases, regular cases that would die, and they have to prepare the bodies. Okay, but we are going to have that detailed discussion to address their concerns tomorrow.
But you're sure that there are no bodies with the virus that are still at the morgues or the funeral parlors that could be a threat to anybody?
Remember that we saw our we confirmed our first imported case on the 10th of March. This is a new virus, and we would only be looking to persons coming into the country with the virus. So our detection is to really try to pick up as early as possible these cases. So we would not have any cause to believe that we have any bodies that are presently in the morgue that may have been deaths due to COVID-19. We have absolutely no reason to believe that.
And what, just one other thing, Dr. Tufton. The Minister of Finance said today that the contingency that is available to you has been increased to 10 billion. I wonder if that is reflecting what the government sees in the future, that it might be much more than we understand.
No, well, I believe it's the government taking a responsible position. We recognize that this has the potential to have significant impact. I mean, these restrictions alone are going to have an impact, and the minister spoke with some very specific announcements today around, stimulus, encouraging continuation of businesses, employment of persons, because we have all accepted as a country, as a government, that the assumptions on which the budget was predicated when it was delivered in the Parliament, and the Prime Minister, of course, is yet to speak, so he will factor more of what is happening now in that, but certainly the Minister of Finance would not have anticipated some of what was coming. Those assumptions have to be adjusted. And so what you would have heard today is a reflection of that adjustment, or at least the starting point of that adjustment. I'm sure you will hear more going forward. But it is all in the interest of trying to ensure that no one is placed at a significant disadvantage, no individual group or interest is at a significant disadvantage, that those who are most vulnerable are given adequate protection, and that we can resume normality as quickly as possible by giving the full strength of support to public health to overcome this challenge, to flatten the curve, if you will, so that the virus and its impact does not last beyond a relatively short period of time. Can I take 2 more questions and then we're going to break, if you don't mind? Yes.
Okay, yes. You mentioned earlier that you have 3 or 4 communities where contact tracing is being done. We know a lot of rumors are circulating, so is it possible for you to just confirm those, well, name those communities, please?
Well, some of them are already known. I don't think we have there, it's a secret. Everybody knows about Bulbe, which is the most significant. We know about one community in Clarendon. We know about a Kingston 20 area where one other positive was determined. And I think, and of course you know about Montego Bay, where a tourist was diagnosed, and then of course in St. Anne in Ocherius. So, I mean, that's pretty much it. I mean, I don't want to get into details as to the street and the lane, because there are some issues that we have to contend with, unfortunately, where persons become agitated and, you know, fearful, and it could put persons in harm's way. So we just prefer to give the general areas.
Yeah, as a social scientist practitioner, I have to take this opportunity to speak to an issue that is becoming more and more real within the society. With the advent of any new disease, traveling right behind it is stigma and discrimination. And we are beginning to see the signs of some very troubling actions by citizens. We already spoke about the nurses and the fact that the nurses are being denied transportation to go to hospital. But we're seeing where persons are being denied services. And that is troubling because that adds to the complexity of dealing with the issues that arise from an epidemic like this. And so it is up to us, you and us in the Ministry of Health and Wellness, to deal with this issue up front. Because stigma and discrimination always undermines any effort that we make in terms of interventions for the population that might be impacted. And so we need for the public to understand, and therefore we have to provide them with more information, more resources, so that they can appreciate why it is that they should not undertake certain discriminatory actions in dealing with persons who they suspect, and these are not persons who are confirmed, people who they suspect may have contracted COVID-19. So I really wanted to take this opportunity to launch out into that field and begin the conversation around preventing stigma and discrimination from taking root and from expanding.
Let me also mention, and I echo the sentiments of the Permanent Secretary, it is something that we're dealing with. We've heard of cases of persons being, you know, threatened and so on, and we'll use the law if we must, but we prefer to ensure that all understands and appreciate the need to be careful and to exercise sensitivities to the realities of the challenges that we face and work to overcome those. There are some other areas like the mental health and of the population and the need for us to manage that carefully, and we're going to be giving out some additional support, but that we'll discuss that later on. I want to just add that today we had a meeting with all municipal corporations, myself and the Minister of Local Government, Minister Mackenzie, where we discussed with mayors and councillors what was happening and solicited, of course, their support in the drive to inform the public across the country in their communities. Over the next couple of days, you will hear town criers throughout the country in communities with pre-prepared messaging that will speak to the virus, explain what it is, what the symptoms are, what persons need to do if they have a feeling that they are so infected or affected, isolating themselves, calling the toll-free numbers, in an attempt again to sensitize all of us and really ensure that we're all part of the solution. We will also use our vector workers to do some work in terms of the flyers that will go out. So we're prepared flyers, and those are going to go out. I'm asking to clarify the issue of restaurants. As I said earlier, restaurants we're asking for a focus on takeout as opposed to in-house dining. And to the extent that that is happening, it should observe the 20-person limit. Now, that's a difficult one because depending on the size of the restaurant, 20 people might look like a lot, and we're trying to avoid the crowds. So that's why we are emphasizing the takeout as opposed to in-house dining and the social distancing which that represents. You want to say something?
Yes. Our healthcare workers are present in all the communities that there have been confirmed or suspected cases. So I'm just making another appeal that for persons to cooperate with them and to give them the information that they require. The town criers are out in those communities as well, and so persons would have been sensitized to the fact that somebody in the community would have been confirmed. And so, therefore, we're asking persons to stay home. Persons to stay home during this period of time when they're away from work. If you have symptoms, then stay home and call the Ministry of Health hotline. We will direct you where to go. We don't want persons who think that they have had contact or who may have been at risk to just present themselves to hospitals because we want the hospitals to be ready to receive them. So persons should call so that they can be advised. Not everybody is going to be advised to go to the hospital. Some persons, based on the history that they will give, will be advised to stay home, and whatever over-the-counter medications that they should take, they would be advised to do so. Not everybody is going to have a severe illness that is going to need to be in hospital. So it's very important that persons just follow the guidelines that we have set out. Call the Ministry of Health hotline if you need clarity or if you need assistance, and we will provide that to you.
Okay, so can I close now? All right, so let me just thank all of you for coming out. And as I said earlier, you will have this quite frequently, at least for the time being, to ensure that the country normalizes in appreciating what we're doing, why we're doing it. We will provide information as it is made available. I want to take the opportunity in closing to thank our public health staff across the length and breadth of Jamaica, starting, of course, with the team here and others at headquarters. We have a emergency operations center that is open 24 hours every day since this challenge has started. And there's always a number of persons there manning, collecting data, assessing, determining what support is needed in the field. And believe me, they're working long hours. Similarly so, I really want to say thanks to the hospital staff out in the respective parishes who have been doing a lot of work to prepare the hospitals, the isolation wards, managing cases. We have cases in about 5 or 6 hospitals right now, so we're spread out. So the rules of engagement around, protecting themselves, the stresses associated with that, I really want to say thanks. And finally, to the members in the field, the public health staff in the field doing the contact tracing, I want to really recognize them because that involves a lot of work to move around, to search for persons, to interrogate them or interview them. There's a lot of risks too, because you really don't know whether or not those persons are infected until further, checks. And so it really, this is a good example of a community, meaning a public health community that is working together, and of course supported by so many other agencies, the constabulary, the JDF, the private sector. It really makes me proud to be Jamaican, because I really do feel that we're doing what needs to be done. And I really think all of us as citizens should take a bow. Even while we are concerned, we shouldn't panic. Let us press on, because I'm sure we'll overcome. Thank you very much.
You'll always remember that day you became a parent. That day